So I'll just start by introducing myself. So Stephanie, as you mentioned, my name's Taylah Excell. So I'm a senior case manager at the Beenleigh Community Corrections Office. And this is my colleague, Emily. Emily Cooper is a case manager here at the Beenleigh Community Corrections Office. So we'll just be giving everyone a bit of a rundown on community corrections and I suppose a little bit about what we do. Just like to begin by acknowledging the traditional custodians of the land on which we meet today and pay our respect to their elders past, present and emerging. And we extend that respect to Aboriginal and Torres Strait Islander people present today. So just a bit of an overview of Queensland Corrective Services for those of you who might not be familiar. Basically, we're a government agency. We contribute to a fair, safe and just Queensland by managing custodial facilities and supporting the rehabilitation of clients within the community. So QCS is a key responsibility of the Queensland Government, and along with courts and the police, we're a central component of the criminal justice system. In partnership with other key criminal justice agencies, we're committed to the critical role of community safety and crime prevention. So in total, QCS operates 14 correctional centres across the state, as well as 35 community corrections officers and over 140 reporting locations across the state as well. So this ensures that prisoners and clients in the community are provided with appropriate classifications, supervision and access to programs, education and vocational training to maximise their chance of success of reintegration into society.
So who we are. So our strategic objectives are safer correctional environments, humane management of prisoners and offenders, and partnering and community collaboration, which is sort of why we wanted to be a part of today, and also to stop crime. This is just a snapshot of sort of community corrections. It just shows that we supervise over 21,000 people in the community. We've got 36 district officers. In relation to community service, there's been more than 383,000 hours of community service done within the community to a financial value of about 10.8 million. And then you can just see the demographics there on the side as well. Should I take this one?
So types of community-based supervision. So there's a number of different orders that clients can be subject to in the community. So including community service orders, intensive corrections orders, alcohol-fueled violence orders, graffiti removal orders, probation orders, court-ordered parole and board-ordered parole. So the case management process, just in a bit of a nutshell, involves clients who are subject to one of those types of orders, or can be several types of those orders. They come to us at various stages of their lives, each with differing needs and levels of risk. So basically our case management is tailored to suit the needs of that particular individual, as we aim to address the risk that they also pose to the community, sort of a balance between that and their needs as well. So the case management process involves undertaking assessments for each individual client. So basically that's to ascertain what the cause of their offending behaviour is, and in an effort to implement a tailored plan to disrupt a return to criminal behaviour, and hopefully to implement some pro-social supports as well. So case management involves, but it's definitely not limited to, engaging clients in the case management appointments with their officers, both at the office and also in their homes, undertaking programs that are specific to their offending profiles. So some of them are run by QCS and some of those are run by other non-government agencies as well. They may be required to engage in psychological assessment and counselling, And we also really hope to increase their protective factors. So things like stable accommodation, stable employment, and pro-social relationships as well while they are in the community. And hopefully that can provide them with a little bit of stability.
In relation to community service, so community service provides an excellent opportunity for clients to make preparations for the community affected by their offending behaviour, and it can also develop employment skills. So the reparation work is performed by clients in the community under the community services orders, the graffiti removal order, alcohol-fueled violence orders, intensive correction orders, and the work and development orders. So in 2018 to 19, QCS partnered with a number of non-for-profit organisations and local councils to supervise clients performing unpaid community work as part of a court order. So we're kind of hoping, being part of this forum, perhaps we could partner up with some other non-for-profit organisations. The clients that are referred to community service within the community, they have to meet certain eligibility and risk levels as well. So we're not going to put high-risk offenders with like community service projects that are out in the community. We do that a different way. So
yeah. So there's a bit of an assessment process that we'll undertake with each individual client based on obviously their skill set, their interest areas, obviously the types of offences that they're subject to the order for, and hopefully pair them with a really well-suited community service site.
The community service projects can include beautification and maintenance activities such as rubbish and waste removal, graffiti removal, restoration of the park, facilities and waterways. They can undertake education and training to increase employability or counselling to complete the community service hours. In 2018-19, clients in the community completed more than 383,000 hours, as I said before. Yeah, it's a lot.
So I suppose the main reason that we really wanted to be a part of this not-for-profit conference is really just to promote some partnership and community collaboration within the Beenleigh jurisdiction and a little bit, I suppose, more broadly as well. So a huge part of our role with community corrections is engaging our clients with local support services and intervention providers. We really, really want to have a collaborative approach so that that can enable us to increase a client's community connectedness and success while subject to supervision. So potentially there's been, you know, a little bit of misconception or perhaps just not a whole lot of awareness in the community around sort of what our role is in our approach. So we do try to have a really therapeutic approach and lens to how we undertake our case management. Ultimately, our goal is to stop crime and to keep people out of correctional centres. So we feel like a collaborative approach and getting people linked in with their local communities is a really important aspect of that. So as you can see, this is a bit of our strategic map. So the second component of that being strengthen partnering and collaboration. So basically delivering on our commitment to community safety through a collaboration with our government and non-government partners and building and fortifying those partnerships with key stakeholders to provide a safe and sustainable correctional system. So, do you want to take this one?
So we hope to work collaboratively with all local services, including domestic violence support for victims, education and training, substance misuse programs and intervention, Aboriginal and Torres Strait Islander services, services for clients from culturally and linguistically diverse backgrounds, housing and homeless supports, mental health services and supports, family and children, and the vulnerable cohorts within the community, such as the elderly, people with disabilities and
LGBTQ+ as well would be a large aspect of that. So ultimately, we're open to whatever services and support our non-for-profit and non-government agencies are able to provide and support our clients with. They're just a few of, I suppose, the areas that really stick out to us in terms of what we feel like our clients are sort of really looking for. So we hope that this is an opportunity to partner with some of our local agencies and support services, and particularly those other panelists from the conference, to really, I suppose, leverage off the support that you're able to provide us and our clients.
So how we hope to work together. Delivering on our commitment to community safety requires partnering and collaboration with government and non-government partnerships. Building and fortifying those partnerships with key stakeholders is crucial to providing a safe and sustainable correctional system. So information sharing and referral processes, obviously really important. Collaborative case management, joint meetings and co-location opportunities, which is where we can meet at the different locations of where the reporting services are.
Yeah, so I suppose with that co-location opportunity, that's an opportunity for us as case managers within corrective services to potentially work within your space and even leverage off some of the programs or interactions that you're having with mutual clients. But alternatively, there is opportunities for other agencies to be a part of our office and our team to work from our space as well and provide that support to people in our office. And it just sort of removes some of those barriers for clients, whether it be transport or childcare or just time. So sometimes we find that's a really beneficial way to increase a client's engagement and support as well. So this is just a bit of information on the Beenleigh Community Corrections Office. So we're located on 101 George Street in Beenleigh. So it's sort of just next to the Dan Murphys. We will be relocating to a new office a little bit later in the year. That's also on George Street, but a little bit closer to the shopping centre. So that's our telephone number, and I've also popped there our email address. So that's our generic email address that all of us case managers and senior case managers have access to. So if you do have any questions or anything you would like to touch base with us about following this presentation, please do reach out to us. You can either attention it to myself or Emily if you'd like to speak to us specifically. We each carry a particular portfolio, which basically is we're just the conduit for that information and the contact person. So if you have a particular service that you would be interested in providing or support that you might be able to offer or some sort of partnership, then we can definitely link you in with the staff member within our team that focuses in that area. We also have a reporting centre that's set up in Bow Desert, so we have staff members that attend that each week, as well as Coomera Station and Jimboomba Police Station as well. Excellent. So that's pretty much the end of the presentation, but if anyone has any questions.
Brilliant. Thank you so much, guys. Taylah and Emily, it's a real pleasure having you here today. And I think you're absolutely spot on. It's actually really important for not-for-profits within the not-for-profit organisations, particularly within Beenleigh, to get an understanding of what you guys actually do in community corrections and you know, opportunities for collaboration.
Definitely.
Yes, absolutely. We do have one question from Carla. Is a case manager similar to a parole officer? Could you please explain the difference?
Of course. So a case manager essentially, I suppose, is a parole officer. So we're referred to as case managers because we case manage people who are subject to both probation, intensive corrections orders and parole orders. So people are basically just categorised based on their risk and need levels. But we also have community service officers as well. But if you are hearing people refer to their parole officer, then yes, that's people like Emily and myself. So we do have a really close working relationship with our clients. I'm assuming mutual clients for a number of you who would see, I think, the same people that we would see on a day-to-day basis. So we really think that this is a space that we can really leverage off. it's sort of a situation where we don't necessarily have the same level of services that we're able to provide and offer, but we really hope to be able to leverage off that that each other local service has discussed and mentioned that, you know, they'd really like to partner up with as well. So yeah.
Yeah, absolutely. Thanks for answering that. And look, I think this is the start of a conversation for quite a few organisations who have attended the conference. So thank you. And just out of curiosity, it's been a curious question for both myself and Anthony over the past 2 days. But have your roles as case managers shifted since COVID hit?
Definitely. So we've had to really work quite innovatively in terms of how we still can undertake our core business, which is community safety, during what's a completely unprecedented time. It's taken quite a lot of effort and time in terms of working out the best way to go about things, but ultimately the foundation of our role has maintained the same. We're still having contact with our clients on a really regular basis. We're all still working out of the office where we can, just sort of obviously keeping with COVID safe plan and everything like that, but it's definitely been challenging. It's been difficult, and I think one of the things I've noticed is just with the closure of some community services and support services, we've found that some of our clients have really been struggling during this time. So to be able to hear over the last 2 days some of those hotlines and contact numbers that we can provide to our clients is really, really helpful.
Yeah, they're so important for our clients. Our clients really need that support and that community connection, and it's what it's one of the things that keeps people from offending is having those supports and those services available to them to be able to access when they're in their times of crisis or when they really need it. So yeah, we've gotten so much out of the last 2 days. So it's been so good for us.
Yeah, thank you so much for enabling us to be a part of this forum. And I think you really struck a chord when you said that this is starting a conversation. And I think for us, from QCS perspective, we really want to just increase community awareness around our role and what we really hope to achieve, because it's probably not something that I think too many people are familiar with unless they've had some sort of contact with us already. So as I mentioned before, we're a little bit different in that we don't necessarily have a service to offer in I guess similar to some of the other panelists, but we definitely want to be able to leverage off that support. And I know I can speak on behalf of Emily and all of the other case managers here that we definitely have a number of clients on our caseloads that would be really, really grateful for some of the support that you'd be able to offer. So I'm sure that there'll be a number of referrals coming your way.
Brilliant, excellent. That was, one of the big purposes of this conference, smashing those silos and increasing people's understanding of what's out there available to them. So over the next week, Anthony will be sharing some of the slides and the contact details for organisations that presented over the past 2 days. So you'll get that in your inbox within the next week. So
excellent. And everyone, please feel free to reach out, even if you do have any questions, even if it's just sort of down to our role or QCS in general. If you just want to clarify anything, be more than happy to answer any of those. And
or if you think you'd have a good community services project for our people.
Definitely always looking for new community service sites and projects. So if you've even just got an idea, please feel free to reach out and let us know, and we can have a chat about what that might look like.
Fantastic. Well, just chatting to Anthony just earlier, I think he'll be reaching out to you guys with some ideas.
Excellent.
In the future. So
perfect.
Fabulous. So thank you for joining us over the last 2 days and for your presentation this afternoon.
Thank
really
you.
appreciate it.
Much appreciated. Thank you. See you later.